imagine that? Months later, Vivo is back as IPL sponsor. Stadiums could open again, and it seems like things will get back to normal. Not if COVID-19 rears its ugly head once again, and that's really the fear. This evening, as we talk about COVID-19 in Mumbai and Maharashtra, it is with the disclaimer that things are not as bad as they were in July or June last year. We are still better off. Progress has been made, but with the hard and bitter lessons learned, clearly nobody wants to take any chances. And it is in that spirit that, at least in Mumbai city, there are some fresh restrictions in place. Now, it's not any kind of a lockdown. Let's explain first what these restrictions are. Mostly, it's increased vigil. There will be strict fines for those going outdoors without masks, and that has always been the rules, that you must mask in public. People have been lax about it, and now if you are, you will be fined up to 200 rupees. Apart from that, if you have been asked to be in home quarantine, if you've tested COVID-19 positive and you're supposed to be in home quarantine, your hand will be stamped. They had done this in the beginning of COVID-19, that had been done away with, but the hand will be stamped so that people who are asymptomatic and COVID-19 carriers can be identified. Moreover, if a building has 5 or more COVID patients, or at least 5, that entire building will be sealed. Apart from that, testing will be increased. Travelers from Brazil to be placed in 7-day institutional quarantine. So anyone from Brazil coming into the city will have to go into institutional quarantine. They just cannot go home even if they're negative or anyway. A breach of protocol on large gatherings, if there are more than the specified number of guests at a wedding party, etc., those organizing it will face the consequences. So a lot of protocols in this sense have been ramped up. On the other hand, 2 districts in Maharashtra, Amravati and Yavatmal, will be going into a full lockdown over the weekend from Friday to Sunday. So these are precautionary measures right now, but we've been down this road, and we know that when this happens, we have to be very, very alert that cases don't spike. The reason for this level of concern is that daily active cases in Mumbai have gone to 721. That's the highest since the 7th of January. And over the last several weeks, daily cases in Mumbai have been hovering around 250 to 450, 500 tops. This has been increasing over the last few days, and hence the concern that we have seen today. To understand what this really means, let me go across now to our panel who is joining us on the show. I'm joined this evening by Dr. Samdani from Breach Candy Hospital, Dr. Pvt Samdani. Dr. Sushila Kataria, Senior Director, Internal Medicine at Medanta, is also on the show, as is Dr. Ramanan Laxminarayan, Director of CDDEP. Welcome to all of you, and thank you for speaking with us today. Dr. Samdani, let me start by getting your take, because we've seen the BMC, at least, and now I'm speaking about Mumbai specifically, go into action mode when certain statistics and certain data crosses the red line. Are we at that red line now when you need to restrict movement to make sure there is not much spread of COVID-19? Are we at that place right now?
Thank you for having me tonight. So I think what the BMC is following or attempting to do is perfectly correct. We've seen it from the experience of previous countries that when you do get a second and a third wave, it can be more horrendous than the first wave. And I think it's absolutely correct that the BMC springs up and goes back to what it was doing about 4 or 5 months ago in terms of following the strict precautions and the guidelines that they've laid down. We've certainly seen a rise in the number of cases over the last week or so, and that was kind of expected with the local trains opening up, people being very complacent as they are, although there have been restrictions and guidelines, and people have been reiterated again to wear their masks, keep a social distance, physical distancing. However, we do need to follow these, and I think the BMC is doing the correct thing right now.
Okay. Dr. Ramanan, since there are specific guidelines for people coming in from Brazil, and this is for Mumbai specifically at this time. Also, the BMC has been saying that a lot of traveling has been taking place. Those taking domestic or international flights has also gone up, and that has raised concerns. Are we possibly looking at a second wave, and B, some kind of mutations coming in which are spreading faster than the first round, and that really is the concern?
Tamanna, it's the honest truth is that we don't know, and I think that is the only way to really put it. We have areas of uncertainty. One uncertainty is, of course, the variants, which are not only from Brazil, they're also from South Africa, which appears to be the most concerning sort of variant from the UK and also from Brazil. I don't know how many travelers from Brazil come to India at this point in time, but I would imagine it's smaller than the number that would come in from the UK or South Africa. So I'm curious as to why those two were not included. Second is that in the first wave, Mumbai has already had a large number of infections, even if those were not necessarily detected. All of the evidence, including from ICMR, shows that we've undercounted infections by a factor of 30. I think that number is probably by a factor of 50. So we probably have pockets of immunity in Mumbai, but there are many places in Mumbai where people have not stepped out, and those are the folks who account for the infections now. Number three, we also have a situation where testing is highly focused on some populations, and those populations are getting tested mostly for travel and so forth. We don't know to what extent we've had new testing for people who are really sick. And we really need to also, on top of the masking, make sure that we're expanding the testing to reach people who normally don't reach testing facilities. And they might be in the outskirts of Mumbai, they might be in suburban areas who are coming in on the trains. And unless we're able to control the disease outside on the periphery of Mumbai, it's very hard to control it in just Mumbai alone. So I think there's a lot of work that lies ahead. But I think the positive part is that given how badly Mumbai was hit in the first rounds, I don't think a second wave will be quite that large. It will be probably a lot smaller, but there'll still be a lot of avoidable infections and deaths at a time when we have a vaccine.
Do we, Dr. Sushila, have a plan in place? Because so far, frankly, with the vaccine coming in, India's numbers, daily numbers consistently being low enough, even under 10,000 all India-wise, the fact is that people have let down their guard. You feel that it's over, it's done with, the worst has passed. We are genetically, somehow blessed, and we're not getting COVID-19 to that extent. And the fact is that that mindset has come in. As a nation, do we have a policy plan for a second wave? Are we accounting for it at all?
To everybody's pleasant surprise, we as a country have done better than everybody expected us to do. Even what we expected ourselves to do, we have done better than that. But this infection has taught us that nothing can be taken for granted. If it has not, it has been good now, we can't be sure or 100% that it will stay good like this. I would agree with sir that, I am not expecting a major surge in the metro cities now, but the second tier cities like Amravati and, you name few cities around the bigger cities, they will be the worst hit now if the plan is not in place. So what is a plan? There is no other plan than, we have to expedite the vaccination, not only to the frontline workers, not only to the healthcare workers, to the general people who are especially more likely to have a severe disease. So I think if there is a vaccine available, there should be a plan. For the government to decide, we as a doctor, working in hospitals, we can comply with whatever government asks us to do. But I think we are wiser now, treatment-wise, we are more resilient, our mortality rates have been less, and there have been a lot of unaccounted infections that has shown in our study as well. But a word of caution that if it has not been so bad so far, we have to be cautious. I don't think the second wave will be as bad as it was the first one, but yes, the numbers can swing up and down for some good time, and it's there to stay for at least a year more.
No, so Dr. Sushila, are we possibly looking at a second wave? Because right now the narrative has been that this is happening just in Maharashtra and Kerala. So my question then is that will we need more restrictions to actually stop the spread? A lot of nations have gone in for what they're calling circuit breakers. where for a few days they're imposing a lockdown to completely break the spread of the infection. Now we know that that is a very harsh measure that we don't want to do, we cannot afford it. Will these piecemeal measures, like what the BMC has done this evening for Mumbai specifically, will it actually help in stemming the disease?
I think this is the time we have to be more cautious. Even I would say that those containment zones should be, more restricted. Even a 24 to 48 hours lockdown may not be sufficient. And, economy has to open and everything all said and done. But mask is the most important thing unless you don't get vaccinated properly and you have immunity. So whether there is a complete economic lockdown in particular area, I would say that's not feasible right now because people have suffered enough. But yes, fine on mask, and be it through education, be it through fine, be it whatever it takes, people have to respect the mask in public places, and there should be restriction on public gatherings, and that is what is going to take us far, rather than having a dictatorial sort of a situation for that. I think people should learn this is for their own good. By now, we should be in a position to understand that mask is for our own good, and wearing it properly is the only way we are safe from COVID and many more infections like that.
No, Dr. Ramanan, same question to you, that if we are possibly looking at a second wave and mutations coming into the picture, I was speaking with Dr. Shashank Joshi a few days ago, and he said in Kerala there seem to be some mutations. Then are these kind of precautions going to be sufficient? Because in Mumbai's case, remember, we've opened up the local trains now. There are 15 lakh additional people traveling every day. Things have pretty much returned to normal. And I don't think people are in the mood or will be able to tolerate going back to the situation we were in last year. So is it going to be enough to take these baby steps to ensure that numbers go down?
So Tamanna, you've heard me on this since a year ago, so March of last year. And my deep concern back then was that this was a new disease for which we were unprepared, for which a doctor in an ICU would not really know what to do with the patient, and case fatality ratios were likely to be high. That is no longer the case. I think case fatality ratios have dropped because the medical profession is better equipped at dealing with the disease. And where we're headed to, whether we like it or not, is a world in which COVID is going to be an endemic disease, much like seasonal influenza or many other diseases that we live with, tuberculosis. All of these are or dengue or chikungunya. It will continue to be around. Unfortunately, it will continue to have a high mortality effect on the above 50 population, and particularly the above 70 population. So vaccination is really the only way in which that population is going to be protected. But I think we have to return to normal with the understanding that COVID is not going to go away, and these cases may go up or down, with incoming people, or there will be waves, but much smaller ones. But I don't think, expecting that somehow in 6 months or a year from now, even with a vaccination campaign, that there will be no COVID cases is simply unrealistic. That's not what we see with any virus. So we just have to adapt to this new normal. And fortunately, even with the new variants, and even with these cases, what we find is the mortality rates are much lower. And a large part of that decrease in mortality is not necessarily because of, I don't know of the genetic explanations, because I don't think any of them is especially compelling. I think a large part is simply that medical care has now improved to be able to take care of patients much better. And kudos to the medical fraternity for figuring that out. And that's really what is going to take us forward. But let's all be prepared for an endemic disease. An endemic disease being one where we have it around us all the time, and we just learn to adapt to it.
Yeah, Dr. Samdani, do you agree with that we have to, live with this? And I also want your view on vaccinations and the pace of vaccinations. In the face of these fears of multiple waves, do we really need to now push up the pace at which we're vaccinating people, at least the most vulnerable parts of the society?
Tamanna, thank you. I think I do agree that we do need all precautions to be in place. In terms of the vaccination, it's very, very important to speed up the rate of vaccination. I think the government is doing a great job by, they've got the frontline people ahead, they've got the healthcare workers ahead, they're getting the elderly above the 60 and 70 with comorbidities right in the front. But we do need to step up production. It's very, very important. And I need to say it loud and clear that although you get vaccinated, especially after your first dose, it's not that you start getting immunity on day one or hour one or month one. The immune system robustly kicks up only after 2 weeks of your second dose. So I'm here to tell everyone here, although you get immunized in the next 1 month, it's not that you're not going to get COVID. Also, the studies have shown that when you get immunization or vaccination, the incidence of severe disease decreases. It does not mean that you cannot get COVID. That means if you do get COVID or if you get any other variant or genetic mutation of COVID, we know that the incidence of transmissibility is high, not that of mortality. We don't want more numbers, and certainly not, we don't want more deaths. So even if you do get vaccination, it's important that you keep your guard on. You are here playing a sport that has risks. When you do a sport that is risky, you take your precautions. You play cricket, you wear a helmet. You do skiing, you wear your guards. So you're on for this disease that's going to stay for years. It's not going to go away tomorrow. And we know that over the past 400 years, that every century we've had an endemic disease, we know it stays there for years and sometimes decades. So I think we need to put ourselves on. I see the entire city of Mumbai, especially where I'm living right now, out and out, all around the place, not following the rules. And it's for ourselves. We need to be careful for ourselves. If you help ourselves, we'll be able to help the community. Think of your parents, think of your children. We need to be careful.
But this is the thing, that it's not just if Mumbai is not following the rules, large parts of the country are also not doing anything more than people in Mumbai or Maharashtra and Kerala are doing. So clearly the disease is behaving differently in different patches. I want to pivot the discussion a bit towards vaccinations now, because COVID-19 we have to live with. We have to deal with the fact that there might be spikes like this. And the way out that we talk about is vaccinations. Now, are we vaccinating quickly enough? And is the way we're vaccinating quickly enough? A very interesting perspective penned recently by Mr. Naushad Forbes. He's joining us on the show today to speak about it. Mr. Forbes, thank you so much for coming in on the India development debate. I just want to really know your view about the pace of vaccinations and especially the role that you think the private sector can have in it.
Thank you for your kind comment on the article in yesterday's Business Standard. I should clarify, first of all, I'm not a doctor. I'm not an epidemiologist. I'm just a concerned citizen. And that's my perspective. Now, the argument that I'm making is that we've laid down from the government the right protocols. It was mentioned just now on your show. Of starting with healthcare workers, then going to frontline workers, then going to over 50s and people with comorbidities, and then opening it up more widely. That's the right protocol. We started quickly. We pointed out that in the first week, we vaccinated more people than anyone else, any other country in their first week, and in our first month, more people than any other country in the first month. But there's a big but. The big but is that if we vaccinate our population at the same rate that we did in the first month, which is 8 million a month, then that says it's going to take us, if you do a back of the envelope calculation, it'll take us 17 years to get our entire adult population of 800 million with 2 doses. Obviously, things are going to speed up. They'll speed up in the normal course. But I think we can do a lot better if we free things up for the private sector to get fully engaged and involved in vaccinations. This might mean that a few people get the vaccine out of turn. And I think we should just say that's too bad and ignore it and get on with vaccinating millions and millions. Because our task, it seems to me, is to vaccinate somewhere between 4 and 5 million people each day. And if we can do 4 or 5 million people each day, it's not a small job, it's a massive task. No other country has ever done it ever in the past. If we can do 4 or 5 million a day, then we have the chance of really getting ahead of this epidemic. So we will then be able to keep the transmission rate down below this magic one figure where it otherwise tends to get into exponential growth.
You know, I found that calculation very interesting, Mr. Forbes, and you're right, 17 years is too much to wait, which is why I would like to include all my participants and experts who are in the conversation today for their perspective on this. And Dr. Sushila, let me come to you. The pace of vaccination is the concern. Now, there are reports that the CoWIN app has its glitches, and that is an issue, like the second dose was not updated clearly enough. Then there are reports of some hesitancy on behalf of medical professionals as well, and we've seen underutilization of vaccinations in certain states. The question is then why not open it up to those who are willing and want to take the vaccine?
Absolutely, and I am in agreement with you 100%. The app misfunctioning or non-functioning of app is a true state, because my second dose has also not been upgraded for the last 3 days. So that's another issue, but I think we need to open it up, and I want to start another debate also. Those people who have already been infected, they have a reasonable level of immunity. So putting them on a little later date for vaccination and giving priority to those who have never had infection is a good idea, or giving just one dose to those who already have an immunity, because our research shows that they are building good immunity even after a single dose. So this would be a rational use of vaccination, and you can cover more. I think there are two bottlenecks here. One is the production. If production is sufficient, then operations for this big country who has run a successful vaccination program for polio immunization is not a problem. So I think if we can take care of the first bottleneck, and if there is some bureaucracy in between which can be handled, this is very much doable, I think. Even if we vaccinate 50% and we presume another 20% are already immune to this disease, this we could be in a herd immunity state very, very soon. That's my take on it. I mean, that's my personal opinion.
You know, Dr. Ramanan, just your take on the pace of vaccination. Yes, correctly said that we have vaccinated more people than perhaps anyone else. We've reached those landmarks very quickly. But we seem to be holding back, and it seems to be a strategy to hold back and not go too fast. There is also a strategy not to include the private sector, and one can understand it from the point of view of making sure that those who can afford to don't jump the line and get vaccines earlier than those who can't. Fair enough. But how do we make sure we quicken this? Now, one estimate has come that the private sector will be able to have access to vaccinations only by the end of 2021. Wouldn't that have too much time being passed for enough of us really to get immunity?
No, I fully agree with you. And, I'm sympathetic to what the government situation is right now. We have two vaccines, one of which, the serum vaccine, which has not really been tested widely in India. They probably want to get more data on it before they really push it out at major scale. And it's not a shortage of vaccines, because India is donating vaccines left, right, and center to other countries. And Serum is also sending vaccines abroad to the COVAX program. And the other study, which is by Bharat Biotech, which is the other vaccine that's being used, that's probably challenged by the fact that COVID cases have dropped off. So to run a clinical trial, you also need to have a lot of COVID. And one of the challenges with having the coronavirus cases go down is that it takes you longer to complete the trial. And unfortunately, this drop in cases is bad from the perspective of getting the phase 3 data. So we're stuck in that situation where it's actually approved for use in clinical trial settings. That's really what it's been approved for, not as a general vaccination campaign. Although, some may think that that's the way it is actually approved. So we're sitting in that situation. It isn't as if we have a phase 3 past, 2 vaccines that we can roll out at full speed. That's number one. Number two is, of course, this issue of, how fast we can actually vaccinate. You have to remember that India struggles to vaccinate even, 20 million children a year. The pace at which if we're getting to, 2 million vaccines, 8 million a month, that's actually spectacularly good, because even during the polio program, we don't vaccinate, that quickly. We do, and that's, remember, polio, the pulse polio is really of oral polio vaccine. It's putting drops in a child's mouth, much easier than, an intramuscular injection, which is a lot more complicated. You have to train people in a very different sort of a way. So I think India is doing quite well with respect to vaccination, and I think it will do much better. I think we can get to that, 2-3 million a day mark as well, once it really gets out everywhere. But let us not underestimate the challenge with hesitancy. I have heard of a lot of healthcare workers who are reluctant to get the vaccine. Many people question why the leadership, the political leadership has not gotten the vaccine. They're probably doing it in good faith, thinking, well, they shouldn't be ahead of the line of where, healthcare workers are. But we really need some sort of a voice and a boost to the vaccination program. We need to have certainly all kinds of leadership, whether it's, the film fraternity or the sports or whoever else that people listen to, I don't know. Just like we do for polio, religious leaders, everyone really pushing the vaccination program. And I think it's going to take a societal effort to make that happen. This is not just a matter of getting needles into people's arms. It's really a function of everyone saying, listen, we're not going to let hesitancy stop us. We're really going to get out there and get vaccinated. Unless we do that, the efficiency of vaccination is going to be really low. We hear a lot of people who don't show up for vaccination, for instance.
Exactly, but that's the irony, that there are people who are not showing up for vaccines, and there are people who want vaccines, but they're not in the queue. They're not eligible yet. And it just seems like a bureaucratic muck-up which is not allowing it to move forward. Mr. Naushad Forbes wanted to come in. Yes, Mr. Forbes.
So two very sort of layman comments. First, it's not the case that we do not have an availability of vaccines here and now. The numbers we're hearing from Serum Institute is that they have literally tens of millions of doses available with them in stock. They've had them for over a month. They continue to have them. They've exported a whole bunch of them. And the only reason why they are not in full production as of now is that they do not have enough space to store more vaccines that they make. So as of today, maybe we'll have a shortage in the future, but as of today, there's no shortage. We have an abundance of vaccines available. And these are vaccines, remember, that have gone through phase 3 trials, not in India, but phase 3 trials overseas, and a limited phase 3 trial done by Serum in India as well. So we have reasonable assurance that the vaccine works. The second thing that I would say is that the hospitals that I'm talking to at present, and I'm talking to several hospitals in Pune at this point, all of them, without exception, say that they have the capacity today to vaccinate many times the number of vaccines they are actually giving. The reason they are not giving more people the vaccine is twofold. Number one, they're only being given 200 vaccines every 2 days. So they only get about 100 vaccines a day. And second, they have great control over who they can give the vaccine to. It's this limited list of people who have been registered and approved on the site. That's what we need to open up and free up. And I think we should be less concerned about, we're not Israel with 9 million people or Singapore with 5 million. We have more healthcare workers than Singapore and Israel have population. So we cannot do it in as organized and neat and systematic and lined up a way as Israel or Singapore. Our process will need to be messier, but it will need to be a whole lot more powerful because our task is much, much larger. And so we need many more people involved in this process. And we can get them. There are people available now. So I'm saying, forget the philosophical question, forget the principal question, just answer the practical question. We have vaccines available sitting in stock with the company wanting to get rid of them, right? We have hospitals that have capacity to vaccinate more. Why don't we let them get on? And we have many people who want to get vaccinated. Why not let these three things come together and see a much increased rate of vaccination here and now, right now, tomorrow, and not a month from now. It will happen. Yeah. All this will get sorted out in the next month, but why don't we sort it out now and let things move ahead now instead of waiting for a week or waiting for a month? A last comment. I think the timing is everything. Timing is everything, because at present we're in the fortunate situation in the country of having a relatively low infection rate. It's come down, as you know, from around 100,000 a day in September down to between 10 and 15,000 a day in the last month or so. But in Maharashtra and Kerala, the rate is starting to tick up again. If we can get the vaccine administered really successfully and widely in Maharashtra and Kerala, can we turn that curve down again? If we see this, if we wait until the infection rate rises to 100,000 or more again, then we just, we'd have missed a huge opportunity to really get this whole epidemic in control.
The timing of this conversation is so crucial. We're talking about it on a day when a spike to 721 in daily cases in Mumbai has everyone's red flag up. And we need to figure out how to avoid scary situations like that. Dr. Samdani, I want to come to you on 2 points. One is on vaccine hesitation within the medical fraternity and the underutilization of capacity within our medical system, at least the private medical system. Both points have been made on the debate, and I'd like your comment on them.
So I think the private sector is completely geared up. So they give routine vaccinations for other diseases. That means they have storage capacity, they have professional efficiency, and of course they have availability. And if they get availability of vaccines, they'll be easily able to administer it. I think what the government wanted in the first phase of healthcare workers and frontline workers was to make sure that there's an even distribution to this category of people across the country. Now that the first phase and the first shot of most of the healthcare workers and frontline workers are done, I would agree that we could open up this immunization schedule or program to the private sectors and thus to the other hospitals. In terms of fear of vaccination, I would not be hesitant to say that there was an initial fear amongst medical professionals, healthcare workers, and thus it percolated down in terms of taking the vaccine. And the fear was more because of reports of side effects or supposedly side effects related to the vaccination, although they were not really related to the vaccination. Every vaccine that we've taken right from childhood till now has some form of side effects, and these are really, really minor, like pain, redness at the site of injection, a little soreness, maybe flu-like symptoms for 24 hours. I've taken my first shot, and I can tell you, you may get some side effect, but it's really typically by the clock for 24 to 26 hours, and it does not incapacitate you. It not does debilitate you. It's extremely safe. I again repeat, and I've said this on your program before, Tamanna, that there is no vaccine for the stupid. If you vaccinate your dog and vaccinate your children, why are you fearful to vaccinate your own self? So I urge the entire population to come ahead when the vaccine program opens up. Go take your shot. The government has also been very, very careful to take a detailed history. And when I can tell you by my personal experience, they're doing a wonderful job. They were polite, systematic, very comfortable, and they actually made you wait for about 35 to 45 minutes after your shot to make sure that you had no deleterious effects. So they have tried and tested in a large population, and I think this can go en masse quickly. We should go ahead.
Yeah, so it's the question is, about speeding it up now. If there are people with hesitancy who do not want to take it, then allow the people who do want to take it to come forward. Maybe speed up the process of those above 50 with comorbidities getting on. It's expected to happen in the next couple of weeks. If there are glitches in the CoWIN app, fix it or find an alternative mechanism that works. But we need to do this faster rather than sooner, I think, is the point that Naushad Forbes was making, and many seem to agree. Meanwhile, I need to take a very short break, but I want to thank all of you for joining us on the lead story this evening on the India Development Debate.